Combating long-term fatigue. Can this be done? What's the NHS said?
Right, OK, I can't do a surgery, really, without seeing somebody who's tired all the time. And what I do is I usually run a few blood tests because there are physical causes, thyroid problems, diabetes, liver, kidney problems and so on. Most times in the NHS, because we're under such pressure, I don't bring people back for tests that I expect to be normal, and this is one exception. Because I do, and 99 times out of 100 they are normal, that gives you a reassurance that there isn't something physical going on. But it gives me the opportunity to talk about being good old-fashioned run-down, lifestyle factors, could this be early depression? So, yes, people are chronically fatigued, but we were talking earlier, weren't we, that actually most people don't need a specific clinic. Some do.
Yeah, I mean, I'm tired all the time, but that's not to say it doesn't exist. Actually, fatigue is a common problem. 1 in 10 people at any given time will feel fatigued. That's tired for a long time. Doesn't mean that you've got an underlying medical problem. And in fact, you're more likely to not have an underlying medical problem that's identified. But in the past, those people have found it difficult to access help. So it's been a case of, well, you know, I'm afraid you'll have to just go and try these different things. This new clinic that's been set up is for people who suffer from fatigue, who are not falling into the group necessarily of chronic fatigue syndrome or ME, as a lot of people call it. There's a lot of controversy around that anyway, who haven't previously been able to access help and now might be able to get an assessment and management. As far as I'm aware, it looks
going to be quite busy then, isn't it? If one in 8 Britons are affected by long-term fatigue.
I would say hopefully not, because I think the whole point is that we, as physicians, need to be very careful about who we're referring into that kind of clinic.
Right, I see.
You know, so we need to make sure if it's a lifestyle thing, we're dealing with lifestyle.
And let's not over-medicalise it, I think. That we need to be very careful we don't do that. Maybe, like Dawn said, look at our lifestyle factors.
What about the fact that we should stop washing our hands? Tim Spector, the Professor of Genetic Epidemiology at King's College London, has said that we shouldn't wash our hands before a meal and that we're over-cleaning.
Do you know what? I hung my head when I read this. I was just like, I can't believe someone is saying this. We've done so much good stuff, from hand hygiene.
We have. We're sneezing into a tissue, washing your hands.
He said you don't necessarily need to wash your hands after you've gone to the loo because your own microbes are better than everybody else's.
What about worms?
Yeah.
What about worms? You know, and particularly for kids, I think I do buy into the fact that we are all too clean and we're sort of we're living in this kind of sterile bubble. That's not right. But at the same time, I think it's a really good practice for kids to get into the habit of washing their hands after going to the loo, before they come to the dinner table.
Yeah. And anyway, you said about your own germs. What about when you flush the chain and somebody else has been there? I mean, it's like,
and we're just about to hit cold and flu season.
Exactly.
We could probably do away with things like antibacterial hand washes and soaps and things because they're not shown to help, and actually they may even be harmful because of the other chemicals that are in there. But simple, straightforward soap and water.
Right, OK, antibacterial soap. So just ordinary soap is all right?
Normal soap is absolutely fine.
This is interesting. Pet dogs may help children avoid asthma.
OK, let's put this in context. There is one study which says that if children are exposed to dog dander in the first year of life, they may, at the age of 6 and 7, have a reduced instance of asthma.
What's dander?
It is where dogs lick themselves and the saliva and the fur and skin comes off, and that is an allergen. My worry about this is that actually 2 things. First of all, you know, if you don't particularly like dogs, do not go out and buy a puppy for the first year of your child's life, because actually a dog is for life. Yeah. But more importantly, we must make clear that if your child already has asthma, which is triggered by dog dander, having a dog is going to make it worse, not better.
Yeah.
And previously, evidence on this has been conflicting. This is a study of about 1 million kids, so it's, you know, it's quite a large study. The only problem is that they found that at 3 years there wasn't any difference, and at 6 years there was. So actually, a lot of kids grow out of wheezy conditions
anyway. Yes, oh, that's true.
So I still take it with a pinch of salt, but like Dawn said, if you've got asthma, don't go out and buy a dog because it might make it worse.
No, and also, if you're pregnant, don't go and sell your dog. You know, you know, there's a halfway house here.
Yeah.
1 in 100 are given the wrong meds.
I find that a bit of a surprise, actually.
Well, this is the researchers from the Universities of Manchester and Nottingham.
Yeah, the reason I find it a surprise, we both did, actually, because there are so many systems in place to prevent errors happening, and we get safety warnings flagged up all the time, especially now that we use computer-based systems. When a patient is admitted to hospital where I work, a pharmacist will go through their medications and have a look and see if any of those can be taken away or if any of those might be causing a problem. My argument also would be that actually we probably over-medicate ourselves and expect a pill for every problem, and that's part of the reason why we suffer ill effects from it as well.
I mean, I would agree. I think we have all sorts of systems. So in general practice, if I type in to give you a medication, you're already on my systems taking other things, it will flag up. But also, and I know patients sometimes find it frustrating, we bring people back every 6 months or every year, whatever you're on, we'll have a time frame. And part of that is to have a medication review.
Right.
And we do that to make sure that there aren't any problems. Also, we are obliged to have what we call significant event meetings. So if there is a problem with interprescribing and so on, that is flagged up as a very serious issue, and we all have to discuss that and put systems into place to make sure it doesn't happen again. And part of revalidation, part of allowing us to continue to practice, is that we can demonstrate that we're doing that. So, like Ranj, I'm really surprised at the numbers. I think we've got to be honest. We are humans, so mistakes do sometimes happen. We have to do everything that we possibly can to stop it.